Hello friends, this is Dr. Ateet Sharma, Senior Joint Replacement Surgeon, KD Hospital, Ahmedabad. Today we will be talking about the CORI Robotic System. CORI is the short form for Core of Real Intelligence. This robotic system uses infrared technology to do real-time mapping of the bones and cartilage using landmarks and multiple mapping points without the use of preoperative CT scan. This is a portable, compact robotic system which has the smallest footprint in the robotic knee surgery segment. The CORI robotic system is designed to help surgeons achieve more accuracy in bone resection and alignment by using artificial intelligence. Your knee replacement surgery is unique based on your knee anatomy and the implant used. Proper alignment of the implant is a crucial factor in determining how long your implant will last. Any small error in the alignment of your joint can lead to decreased longevity of your replaced knee. To ensure your knee replacement implant is positioned correctly, surgeons use the CORI robotic system. Surgical techniques have evolved considerably since the earliest knee implant procedures were performed in 1968. These procedures relied on manual guides, external pins, and cutting jigs to remove the damaged cartilage and replace it with prosthetic joint. These techniques used long rods inside the femoral canal to get a reference point for placing these cutting jigs. Recent improvements introduced CT scans to provide guidance and create an individualized computer-generated surgical plan for each patient. The latest innovation is the CORI robotic system, a system which uses CT-free technology for precise implant sizing and positioning without the need for rods. The CORI surgical system can be used for both partial knee replacements and total knee replacements. The CORI robotic system offers two distinct benefits to the patients undergoing knee replacement procedures. First, it helps your surgeon create a highly individualized plan that is specific to your unique shape and motion of the knee. While other robotic assisted systems use CT scans, the CORI system uses infrared technology, which means you will not be exposed to the harmful radiation of CT scan. The second benefit is robotic assistance. This combination of advanced technology is designed to help your surgeon for better accuracy, giving you better long-term results. In partial knee replacement, only the damaged portion of the knee is replaced. This means that the healthy cartilage and ligaments remain intact to help your knee joint move smoothly with the prosthetic joint. Patients with osteoarthritis in only one area of their knee are the candidates for partial knee replacement. Patients who undergo partial knee replacement often report a more normal feeling knee, less pain, and quicker rehabilitation. Using the CORI robotic system, your surgeon creates a 3D model of the unique shapes and profiles of the knee. Using all this information, your surgeon can then determine the correct size and position of the implant. Implant sizing and position is critical to the knee alignment and stability. Next, your surgeon uses robotic assistance of CORI to physically remove only the damaged bone, preparing the site for prosthesis before placing and adjusting your partial knee replacement implant. In total knee replacement, the entire knee joint is replaced with a prosthetic implant designed to replicate the shape and motion of your natural knee joint. Total knee replacement is one of the most common procedures in orthopedic surgeries. Most of the people who receive a total knee replacement experience a dramatic decrease in knee pain and an improvement in their ability to perform daily activities. Just as in partial knee replacement procedure, your surgeon creates a 3D model of the unique anatomy of your knee. Your surgeon uses your knee anatomy information to determine the correct size and position of your implant and creates a surgical plan unique to your anatomy. Next, your surgeon uses robotic assistant of CORI to physically remove the damaged bone, preparing the site for the prosthesis before placing and adjusting your total knee replacement implant. Hope you enjoyed it. Do subscribe to my channel Dr. Ateet Sharma for more videos on robotic knee replacement.